Hi everyone and welcome back to my Sunday 9 p.m. live video. I'm Dr. Tani Ping, consultant obstetrician and gynecologist. Actually, one of you did request in your PM to me to talk about teenage and sexual health. And recently, it's all over in the news. One 15-year-old girl in Malaysia who actually conceived and apparently killed the baby. And so I decided, okay, since this topic was in my question bank, and since this issue happened recently, I'm going to talk about it because there are a lot of things that people do not talk about teenage and sexual health. I'm not going to talk about the morality here. I'm not talking about in what way, whether it's good, not good, whether you can have it, you cannot have it. I'm just purely going to talk about sexual health in teenagers from the medical aspect. Just health aspect. Because many do not talk about this and are aware that there are certain problems involved with teenagers having sex. So it's not just about pregnancy. Everybody knows about pregnancy, They don't want to get pregnant. It's all because maybe they're still studying, they're young, they're not married. But it's not just about that. There are still a lot of things we need to educate our teenagers about things that can happen to them when they have sex at a very young age. Okay, so first of all, you need to understand there are some problems that are related to teenagers having sex. First is teenage, especially girls. Teenage girls, bodily, they are still not ready for sexual intercourse. They're just not ready. What are we worried about? We are actually worried about infection. Number one, you need to understand our uterus. You see, uterus is a very unique organ in the sense that there is a passage from outside to inside that goes all the way into the tubes, the ovaries, and into their tummy. Inside, we call the abdominal cavity, which is into the tummy. There is a passage. So if you think about it, anything can go through this passage, right? Bacteria, virus, parasites, worms, anything can just go in and go inside your body. But why is it that more often than not, we don't face this problem? Most women, they have sexual intercourse, but they do not get infection inside in the sense that the bacteria or the virus doesn't go all the way into the uterus, the ovaries, the tubes, into our bowel, goes up to our liver. It doesn't. Why? Because in our uterus, there is actually a passage. There is actually we call a plug at the cervix, just as at the inlet into the uterus. There is a plug, and this plug actually blocks the infection from going in. So when you never had sex before, like most young girls and teenagers, there's no infection outside the uterus at the vagina. That means there's no bacteria, viruses, or even worms, or even parasites that stays in the vagina. There's none. It's so clean, it's so pure. The only thing they have is probably some of the good probiotics that are living inside the vagina. But when you have sexual intercourse, then all this infection actually gets into the vagina. For a mature woman, adult women in their 20s, in their 30s, in their 40s, in their 50s, these bacteria and viruses and parasites and worms or whatever, they will just stay in the vagina. They rarely go in. It's because the uterus is mature enough to block all this infection from getting in. So you have a uterus that totally blocked. Nothing can go in. But for teenagers, this mechanism is still not formed. So the infection, especially bacteria, they can go in through the cervix, into the uterus, into the fallopian tube, into the ovaries, and once it gets there, it can go to the bowel, it can go to the bladder, it can go anywhere in your entire tummy. It can go up to the liver, the stomach, and the whole tummy can get infected. And the thing is, because all these bacteria, when they infect you, you don't know what you will feel. What do women feel when they get this infection that goes all the way in? They feel maybe tummy bloated, a lot of gas. And if you go and see a GP, my tummy very bloated and a lot of gas. And if it's a teenager, a lot of times the GP will just treat it as maybe got gastric because teenagers a lot get gastric. So I'll give you some gastric medicine. So because they get gastric medicine, these bacteria continue to stay inside them and they don't get treated. So the infection stays inside them for months and months and months, and it causes more and more and more damage to the uterus, the tubes, the ovaries, all the way up to the liver, the stomach. And somehow, our own body, of course, we have our own immune system. So after a couple of months, most of these bacteria, our body will settle. We will kill all the bacteria and we are over with it. But unfortunately, the damage has been done. And what does it do? I mean, what does this damage do? Does it cause any problem? Yes. What is it? It can cause blockage of tubes. The main thing in these women are unable to get pregnant when they one day wish to get pregnant. Because teenagers, when they have sex, they're not thinking about pregnancy. But one day, they will want to get pregnant. And by that time, when they want to get pregnant, they will find out, hey, my tubes are blocked. Hey, I cannot get pregnant. Even my tubes are not blocked. Even if your tubes are not blocked, the damage around the tube, around the ovary, can also cause the lady and unable to get pregnant when they are much later. Because once the damage is done, it's permanent. So usually it will cause adhesions around the tubes, around the ovaries, as well as it can cause hydrocephalus. So all these things, the damage is permanent. If you're talking about adhesions, it's still fine. You can do a surgery and solve it. But if you're talking about hydrocephalus, there's no way you can change it back to normal. Because you must understand the tubes go and catch ovaries. The tubes go and catch the ovary. In the tube, this area, there's actually a lot of fine little hair that help the egg to move, help the sperm and guide the sperm and the egg to move within the tube. And all this infection over the months spoil all these fine little hairs inside. And as a result, the tube can either be blocked, or even if it's not blocked, it may not be able to function well anymore. And this effect is permanent. There's no medication or surgery to reverse this situation. So as I say, many teenagers are not aware because probably nobody talks about it. But they do not know that because they have sex when they're teenage, some of this problem is lifelong. Is there a way to prevent all this infection? Of course, we will say best is not to have sex. But the other way, actually, is to use condom to make sure the boy uses condom during sexual intercourse. Sometimes as a parent, we like to tell them what's right and what's wrong, but teenagers is the most rebellious phase of our life. All of us have been teenagers. We know how rebellious we were. But the thing is, we still need to let them know, just in case. They have to know about this thing that can happen to them that can cause lifelong problem, irreversible. So the only way to prevent this is by using condom. Then there's another thing that a lot of teenagers are not aware of as well. Because I notice all these things are also probably not taught in school. We teach them probably a bit about sexually transmitted diseases, but we do not teach them a lot about sexually transmitted diseases that is specifically for teenagers and where teenagers need to know. A lot of teenagers, even my teenagers, when they learn that in school or where they come back and say, I thought use condom won't get sexually transmitted disease. I say, no. Who told you that? No. So even if you use condom, you may not be able to prevent sexually transmitted diseases. And there is one particular disease that will haunt you for the rest of your life, and that is herpes. Herpes infection is an infection that doesn't go away for the rest of your life. And this reminds me because there's this one girl who came to my clinic. She's not a teenager anymore. She's in her 20s, late 20s. But she had herpes infection. And when I told her that this infection stays with you for the rest of your life. And why is it a big problem when it stays with you for the rest of your life? Because this virus stays with you for the rest of your life, which means that you are able to transmit this virus to another person if you ever have sex with another person. Herpes stays with you forever. HPV, which is viral warts also stay with you for a long, long time. Sometimes 10 years, sometimes 20 years. Of course, we don't want to talk about HIV, hepatitis C, which may be a bit rarer, but at least these two infections you prevent with condom. You use condom, you don't get HIV, you don't get hepatitis C, but you can still get viral warts and you can still get herpes. So what I did with my teenagers was, I download the pictures. This is viral warts. I tell you, if you see viral warts of your private part in a picture, you will be like so disgusted. All the teenagers, I have 3 teenagers, all be like, yee. I say, yeah, this is what you can get from sex. And even if you use condom, it does not prevent it. And the problem is, it stays with you for the next 10 to 20 years. That is what? But herpes is so painful. I will show them. These are the pictures of herpes. Herpes is an ulcer. Everyone have ulcer before around the mouth, right? In their mouth. When you have one ulcer in your mouth, you see everything you eat was so painful for a few days, almost a week. Can you imagine 20 ulcers down there? I tell them, ouch! It's very, very painful. And it's not just about the pain. It stays with you for the rest of your life. So if you have herpes, it doesn't matter how old you are, but more so when you do have it when you're a teenager, because you're less likely to marry the person who gave you the herpes. So eventually, you are going to marry someone else. And if you have herpes infection, irrespective of whether you're a boy or a girl, how are you going to tell your next future husband or wife that you have herpes and you're going to give it to them? I'm going to share with you a few stories of herpes. One that I know is that lady in her 20s. She was like, "Doctor, why they never teach us in school? Why they tell us that as long as we use condom, it's fine?" Because she's having sex, she's not married, and she used condom. So she thought it's fine. But it's not fine, because condom does not prevent herpes infection. And now that you have herpes infection, and if the person that you had sex with is not likely to be your husband. If it's going to be your husband, then well and fine, you just scold him, you hit him, you hate him, yes. He stays with you forever, but that's still not too bad. Maybe you want to divorce him, but it's fine. But if that guy is not someone that you are going to marry eventually, then this virus stays with you forever. And the next time when you find the Mr. Right guy, it's going to be so difficult to actually tell him, "I have herpes and you have sex with me, I'm just going to give you." Not many men can accept it, or not many women can accept it. So this girl is like, she say, "Then don't get married." I have another case. This lady is a divorcee. She got married, she's a divorcee, and she got herpes. One day, she wanted to marry someone else, and she found that Mr. Right guy. But she was very honest. She told him she has herpes. She told him that if they have sex as a possibility, she will transmit the herpes to that guy. The guy told him straight no. I said, unless you can get it sorted out so that I don't get herpes, if not, that's the end of our relationship. She's so sad. She went to see a GP that did some tests and told her she has no herpes. And then she came to see me. I said, there's no such thing. That is no such thing. There's no such thing as herpes. There's no more herpes. There's no more herpes in you now, but you carry the virus and you're still potentially able to transmit it to any new sexual partner. But somehow, I don't know what happened, they still have sex. And she transmitted it to him. And that's the end of their relationship, because it is a promise broken. I have one more couple that is even more interesting. This girl had herpes for a long time and she knew that she can transmit it to someone else. So she was very good this time. She actually never had sex with the husband until the day she married. She got herpes much younger when she was not married and she regretted it. And because she was so scared to transmit it to the husband, and also very scared to inform the husband that she had herpes, because she not there to tell the husband of all her sexual activities before she married him. So they never had sex at all until they got married. And even after they get married, they rarely have sex. Almost none. She's so scared to have it. She's so scared to do it because she's scared that she will give the herpes to the husband. She came to me because they've been married like 10 years, like almost never had sex before, and now they're thinking about pregnancy. And she wants to know her options. So you see, it's not that she can't have sex with her husband, but because she wasn't honest with her husband. So she keep pushing off sex and they hardly have. I'm not even sure whether she had it before. I always say, did you try? Never. Why we never have sex? I was like, why you never have sex? Until I dig this story out. So she never had sex with this husband, or probably almost none. The only reason was because she feared that she will transmit the herpes to the husband and the husband may not be happy about it. So this herpes infection is very easy to transmit. Why? Partly is because many people are also carriers of herpes. Because it's lifelong, you see. Once you have it, it's lifelong. They cannot go away. If one man or one lady have a maximum of 3 partners in their lifetime, which I think quite a lot of people have like 2-3 partners in their lifetime, it will just keep spreading. So many teenagers do not know that their happy moments, so-called, can give them lifelong suffering and lifelong troubles. Because it's not just you can't tell your future husband about herpes, but also, what about the pain, the ulcers that you're getting? Can you imagine you have ulcers at your mouth and it hurts you so much, but now you have ulcers down there and it's so painful. Both boys and girls, equal. So these are the 2 things that I noticed that make a lot of women actually regret. Herpes, that's the one they definitely regret. The other one that I mentioned, where the tubes are blocked and the tubes form hydrocelphins, actually most of them don't know. I mean, you come to us when you're in your 30s, you cannot get pregnant, you get hydrocelphins. We just try to help you to get pregnant, we do surgery, we ask you to cut off your tubes and things like that. But we normally don't tell you, because when you're a teenager, you have sex, we cannot tell that man because your husband may be there and he doesn't know about you having sex with someone else when you were a teenager. So we just keep quiet and then we just do what we need to do. We don't usually tell. And because we don't usually tell, this knowledge is something that nobody talks about. So nobody knows. And that's why I have today to inform you this. Then there is another issue about teenage having sex. That is pregnancy. Not because pregnancy is a no thing. No. I'm not here to talk about morality. I'm talking about what pregnancy does to a girl, a teenager. Is there a problem getting pregnant as a teenager and give birth as a teenager? Is there problems? Are there problems? Yes, there are. Number one, again, as I was mentioning earlier in the first problem, teenage body is still not fully developed to have a baby and to give birth. It's still not fully developed. So as if you're too young, maybe if late teens, not too bad, but mid-teens, if you're too young or early teens, actually their pelvic bone is still not fully developed. Our bones have not even fully fused, have not even fully grown to its maximum size. It's not just the pelvic bone, your leg bone, your hand bone, everything is still growing. It is still not to the maximum size. So definitely, childbirth difficulties will be there. You can have obstructed labor if your pelvic bone is not fully formed. So obstructed labor, difficult labor can happen if you get pregnant too early. The other problem would be things like high blood pressure, a ruptured placenta, complications of pregnancy, growth retarded baby, that just whole lots of it, but probably may not concern them so much because when they're teenagers, when they get pregnant, they're not really so concerned about all these problems. It's just the doctors who are taking care of them have to be careful for all these complications that are more likely to happen with teenage pregnancy. These are the problems with teenagers having sex. But one last thing before I end my video, I would like to talk about contraception. I think school taught well. School taught them all the contraception. Now school is a lot better than what I had when I was school. Nobody taught about sex education in school those days. But at least now it's in the syllabus. They do teach, and they do teach about contraception. But many teenagers do not know that what is the best contraception for them. The best contraception for teenagers is double contraception. Why double contraception? Because teenagers are super fertile. Super fertile. And because they're super fertile, they get pregnant so easily, you know. You don't need to count dates, fertile period, what fertile period, not period, during menses, whatever, they'll get pregnant. Trust me, they'll get pregnant even during menses if they have sex. They are just super fertile. Young girls like these, young boys, they're super fertile. We talk about sperms that can only survive 2 to 3 days. For young boys, they probably can survive 5 to 10 days. So, ovulation period, we say about ovulation is just only for 24 hours. If you do not meet the sperm in 24 hours, you do not get pregnant, but not young girls. It can last a lot longer. They're super fertile. So if you just depend on one contraception, the chances of getting pregnant is very high. They need to know that, I know as parents, we try to tell them not to have it, but I still feel that you still need to tell them just in case you have it. Because things like that do happen. They need to know how to protect themselves. And we're talking about double contraception. Guy use condom, it's a must. Guy use condom is a must. Why? Because that is the only way to prevent infection in the lady. I always tell girls, if the guy refuses to use condom, forget about him. Because it only tells you one thing, he does not care about you. Because if you don't use condom, you get infection, you get pregnant, it's all your problem. So if a guy refuses to use condom, forget about him. Condom number one is a must. And the girl must take contraceptive pill. So teenagers, most likely, they're not going to plan sexual intercourse or regular sexual intercourse where you are going to be taking pills every day. No. But they need to know about emergency contraception. If you have sex, the guy must use condom, and you tomorrow go to pharmacy and buy emergency contraception. Unfortunately, can they go to pharmacy and buy emergency contraception? It's not off the counter, That is again another problem that we have. In order to go and buy all these things, they need to get an adult to buy for them. But maybe they have ways, elder brother, elder sister, and hopefully it's their mother or father that will be a bit open. I think parents need to be a little bit open, not to be too strict. Because it's when you're too strict, that is when the child doesn't know where to get their contraception. Where? How? So this double contraception is very important. But of course, if they end up maybe the bigger teens, like 18, 19, and they actually want to have regular sexual intercourse with their boyfriend, then I would usually advise them to go on the daily contraceptive pill or to use a patch or an implant. The other problem that I always realize when a teenager comes to me, because this happened just last month. This mother came to me. She said that my daughter is only a teenager. She's now pregnant, and doctor, where to go for abortion? She asked me. Okay, then my answer to her is no. Abortion is not easy lah. You want to say you want to do, there are people doing it. You just pay and get it done over it. But more important is Are you as a mother educating your child to make sure she doesn't get pregnant again? Then she asked me how. I said, you must educate your daughter on double contraception. Because the fact that she's already pregnant now, there is a chance she will be pregnant again. She will most likely going to have sex again. You must teach her on double contraception. The boy must use condom because, as I mentioned in the talk earlier, the problem of infection in teenagers is worse than in adults. And you must ask your daughter to go on contraception pill. Then the mother will like, pill so young, they got what effect on my baby or not? I'm saying, as a mother, you can never say that. Because when you say that, she believes you. And she won't take the medicine and she will end up pregnant again. And you are going to bring her to abort the baby again. How many abortions do you think her uterus can withstand? Too many abortion procedures cause a lot of damages to the uterus. So, as a mother, we cannot say that. But honestly, if you want to know more about contraception, if you go to my contraception video, I've explained there's actually no problem. No problem at all with contraceptive, whether for teenagers or in the 20s or 30s. Oral contraceptive pill is only not so good for women above 35. There's some side effects for women above 35. But young girls, no problem. So they need to know about double contraception. They need to know about emergency contraception. These are the things we have to teach our children. Once they are involved in relationships like having boyfriend and things like that, we have to teach even girls. I always tell girls, you must be the one who have the condom. Because if I am my daughter, if I talk to my son, I will tell my son, you must use condom. I will tell them, once you have a girlfriend, sometimes you won't know when things get out of control. Make sure you have a condom, keep with you all the time. If for my daughter, I will say the same thing. I don't know when, sometimes things get out of control. As a girl, you should also have your condom with you. Because when things suddenly happen, you have the condom, you insist the boy use it, and then you make sure you go on double contraception because teenagers are very, very super fertile. They're just super fertile. They get pregnant very easily. So, and that's something we do not want. So then if you talk to your daughter, you can talk to your daughter about a lot of things, about what happens when you're pregnant, you have to abort the baby, or you get married, and then you have children, and you cannot study, you cannot work. I mean, these are things you can advise them. Yeah, we advise them, we hope that they won't do it, but we cannot not teach them about contraception. And we cannot not teach them about emergency contraception, and we cannot not teach them about double contraception. That is very important. Okay? Alright, that's all I have to say about teenage sexual health. If you have missed my previous videos that are related, you can go on videos on contraception for women in my YouTube channel. You can go to my YouTube channel, Dr. Tan City Clinic. Please subscribe, please like my video, and turn on the notification button, yeah? So in my video, I talk about I have videos on contraception, so you can explore all the other options for contraception. But for teenagers, we usually advise oral contraceptive pill, patches, as well as implant. Very long ago, I had one implant placed on a teenage girl as well. The mother came to me is because she lost control of her daughter. She said, I don't know how to talk to her. She won't listen to me. Make sure she don't get pregnant, so just put in an implant. Because implant there's no, the daughter does not need to do anything, which means that she doesn't take tablets, she doesn't need to use a pouch. So as long as you have the implant inside, she won't get pregnant. So that's one, many years ago, the mother brought her here. So you want more info on contraception, go to the video on contraception. And also, if you want to know more about hydrocelphins and fertility, I also have a video on hydrocelphins and know more about why hydrocelphins is a big problem to women as far as fertility is concerned. And sexually transmitted diseases, you also can go to the video on sexually transmitted diseases. And I think this time, because this round, I'm going to do a series of sexual health from the young to the old. So I start with teenage, but actually I'll be going on with a different age group as you go up, that relevant to different age group. And I will also touch on sexually transmitted diseases all the way until the elderly, sex among the elderly. So this is a whole series that will go on every week, or almost every week, on sexual health. I do hope that you will share this video if you have a teenage daughter. Let them know about the impact of sexual intercourse on their health. As parents, we can explain the morality and the social impact, but I think it's also important to teach them about their health, and at the same time, never forget to teach them about contraception. Alright, so that's all for today. Thank you and bye-bye.